Hi everyone, Dr. Sunil Dand, internal medicine physician. Latest breaking news yesterday in the United States was that a federal judge blocked the COVID-19 vaccine mandate for healthcare workers across all 50 states. And this happened one day after another federal judge had blocked the vaccine mandate in 10 states. And I'm sure this is not going to be the end of the story. The case may well proceed further, could even end up in the Supreme Court. But it comes not long after the OSHA mandates were also blocked, the Occupational Safety and Health Administration mandate, saying that all employers who employed more than 100 people had to have vaccine mandates in place. My understanding is that that has been blocked and the administration is not pursuing it further. This is obviously very big news in the healthcare world, and I want to go over exactly what the federal judge in Louisiana said yesterday regarding this vaccine mandate. If the executive branch is allowed to usurp the power of the legislative branch to make laws, two of the three powers conferred by our Constitution would be in the same hands. If human nature and history teach anything, it is that civil liberties face grave risks when governments proclaim indefinite states of emergency. During a pandemic such as this one, it is even more important to safeguard the separation of powers set forth in our Constitution to avoid erosion of our liberties. So those are very profound words from that judge, and I'm sure you all have your own thoughts there on what the judge just said. My own understanding as a foreigner, damn foreigner, but that's what I am in the United States. I may be a citizen, but I didn't grow up in this country. My understanding of the United States is that we are a constitutional federal republic where states are granted a lot of autonomy. That's how the country originally was built. And traditionally, it is in the hands of governors to control public health and put forward public health policy within their state. That's why we've seen since the beginning of the pandemic, every state has its own rules. And that kind of probably makes sense as well for a country as large and as diverse as the United States. That's why I thought, as soon as I heard this proposal from the federal government to have vaccine mandates, I thought this is going to be really difficult to push through in a country which is a constitutional federal republic. But if any American out there wants to get back to me on this issue and tell me why I might be wrong on it, let me know. But right now, obviously, a judge has blocked this mandate across all 50 states. We'll see how much further it goes and whether it ends up in the Supreme Court. Now, I'm not going to get into the politics of this issue. I think politics added to most things in life makes a mix which is completely toxic in most circumstances. But especially when politics is added to medicine and science, it is not only toxic but frequently dangerous as well. The last 1,000 years teaches us that very well. We should avoid that mix at all costs. But coming back to the main issue at hand here, we should always remember that vaccination programs, vaccination drives, and vaccination mandates are completely different things. Vaccination programs are to be encouraged. This applies to any vaccine. If we're talking about vaccines which potentially save a lot of lives, help people from becoming very sick, then our job in healthcare is to educate people, it's to guide people in the right direction, it's to share data with them, evidence with them, science with them, and help them make informed choices. Vaccine mandates, however, take things to a whole different level. And I have, as I've said before, I have deep ethical concerns as a doctor and also even as a human being with vaccine mandates. And if anyone wants to come after me for that, you're welcome to, because I'm not budging. I will stand like a rock on this issue. I have ethical concerns because, as far as I'm concerned, the way I practice medicine, my own philosophy of medicine, and always remembering that informed consent is one of the core fundamental basic tenets of healthcare, makes me at odds and uncomfortable with vaccine mandates. And actually, I think if you ask most doctors out there, of course, I talk to many doctors about these particular issues. I have a sneaking suspicion that a significant amount of doctors, maybe even the majority, would also be against vaccine mandates. Now, if we were in a different time and place, if we were talking about smallpox or the Black Death, and we were talking about a one-time vaccine and a realistic eradication strategy, then maybe I would think differently. But clearly that is not the case right now. So how about other countries then? The United Kingdom, my other favorite country. Well, surprisingly, the UK is nowhere near as big on mandates as the United States has been over the last few months. You wouldn't expect that to be the case, but it is. However, the United Kingdom did announce a vaccine mandate for all healthcare workers within the National Health Service, the NHS, which is the main government healthcare service, to take effect from April 2022. I know this caused quite a bit of a stir, and many authority figures over there, many healthcare leaders, even the British Medical Association have come out with statements saying they are not on board with this either. Like I just said, they also raise ethical concerns and quite clearly point out that vaccination programs are to be encouraged, but vaccination mandates are completely different. And actually, as somebody who has been following the situation in the United Kingdom very closely over the last couple of years, I first thought when the policy was announced regarding the NHS vaccine mandate that the United Kingdom government, having followed Prime Minister Boris Johnson and company quite closely, was simply just saying this and was going to reverse it at the last moment. They did a similar thing with vaccine passports in England. I thought they were saying it to encourage people to get vaccinated and weren't going to go through with this in the end. But right now, that is the official policy, a vaccine mandate for all healthcare workers in the UK by April 2022. Again, many leading authority figures in the UK are not on board with this plan at all. So I know every country is different, and I know I have many viewers from lots of different nations, and really with regards to vaccine mandates, the ability to enforce this will depend on the setup of the government, how much power is afforded to the central government, what your constitution says, etc. But let me know what your thoughts are down below. This was the big news in the United States yesterday. A federal judge blocked the healthcare worker COVID-19 vaccine mandate for all 50 states, at least for now. Thanks everyone for listening. Dr. Sunil Dan, MedStoic Lifestyle Medicine. Follow me as well on locals.com. It is an uncensored platform. Link is down below.